COVID-19 is far from over. Thousands are still getting the virus every day. More of these mobile testing stations have popped up around New York as authorities encourage those with symptoms to get tested. But it's not just the coronavirus that has experts worried.
We know that this post-COVID-19 condition, or as some patients also call it long COVID, and some clinicians call it long COVID, is a heterogeneous group of symptoms that occur after the acute illness. So these are symptoms or complications that can happen potentially a month after, 3 months after, or even 6 months after. And as we're learning more, we're trying to understand the real duration of this condition.
And it's because of this uncertainty that many Americans with long COVID are finding it hard to apply for disability benefits.
About 80% of people who apply for disability are turned down the first time, including people who are incredibly clearly ill with long COVID. It's very hard to get those supports. And when you get permission and authorized to get disability benefits, they're very small. It really is sort of enforced poverty. And it's incredibly difficult for anybody, but especially for people who may have many out-of-pocket costs.
A household pulse survey in partnership with the Census Bureau finds that around 16 million working-age Americans have long COVID. 2 to 4 million of those are out of work due to long COVID, while the annual cost of those lost wages is around $170 billion a year. In recent months, about 5% of new disability claims filed by ALSAP, an Illinois-based firm that helps people apply for Social Security, involved people dealing with long COVID, and some patients don't have the required documentation to apply.
We know people are losing their homes. We know that people are at risk of losing their children. This is a drastic crisis, and that for some people, the suffering and pain of the illness is compounded by the loss of resources or even a home.
Many people living with long-term COVID don't have the financial resources to hire a lawyer or even a doctor to get government help. Advocacy organizations are pushing for a more efficient and streamlined application process. Right now, the waiting period is about 2 years. Too long, many would say, for someone in need. Jody, CGTN, New York.